So welcome everybody to this webinar on the role of essential caregivers. My name's Helen Warbaugh. I'm the director of the Relatives and Residents Association. We are a charity working for better quality of life of older people needing care. We champion the rights of older people needing care across England by providing information, advice and support to older people and their families and friends via our helpline. And we feed insights from our helpline into our campaigning and wider lobbying work to influence policy and practice. We've organised the event today to provide more information about the role of the essential caregiver. The Relatives and Residents Association have been working with a coalition of organisations, the National Care Forum, Age UK, Rights for Residents, St John's Campaign, and we wrote to the Prime Minister calling for the role of essential caregiver to be recognised. It's very welcome that that's now included in the latest government guidance on visiting in care homes, and that's been in effect since the 8th of March. However, we know from our helpline that rollout of that role has been limited. There was a lot of media focus on the other types of visiting included in that guidance, particularly residents having a nominated visitor for regular indoor visits, but less attention or promotion has been put on the role of essential caregiver. And so we're working to change that. We've written some frequently asked questions based on what we hear via our helpline to help explain the role and to encourage care providers to roll it out. We ran an event last week with care providers to help promote it, organised by the National Care Forum, and I shared some of the barriers that we've been hearing from families via our helpline and what care homes can do to help overcome those barriers. So today's event is aimed at families and friends of those living in care, giving you information about the role, tips on how to get it, and we have some fantastic speakers from a provider perspective about facilitating that role, and from a sort of family relative perspective on actually getting the role. So first thing I'll do is just give some information about the role. So it was introduced, as I say, in the government guidance on visiting from the 8th of March, and it runs alongside the other types of visiting. And it recognises that some residents need more support from relatives or friends, a greater degree of contact, or actually help with personal care. So an essential caregiver can visit more often, they can visit for longer inside the resident's room and have closer contact, and that means even during outbreaks. So individual assessments have to be carried out to see whether an essential caregiver is needed as being central to the resident's health or well-being. So for example, if that person needs help with their personal care tasks, like support with eating or drinking, if they need emotional or mental support, or it may be that the essential caregiver's presence is actually beneficial to the resident's well-being, for example, by helping to relieve distress. So the important thing to say is that the essential caregiver will be subject to the same testing regime, the same PPE arrangements, and the same infection prevention control measures as staff. So that is very much a snapshot of the role, and we'll go into more details as we hear from our speakers. I think the really important thing to remember right at the outset is what we're talking about here in the visiting guidance is very much a temporary solution to the immediate crisis that we face during COVID. I think we all want to see the restrictions on visiting end as soon as possible and get back to an open door policy in care homes as soon as that's safe to do so. But until then, the essential caregiving role is fundamental to protecting well-being. And we want to see full rollout in all care homes and offered to all residents who need it. So I'm going to hand over to our speakers now, who are all going to speak for just 5 minutes each, so that we've got time for discussion. I'm going to go first to Vic Rayner from the National Care Forum on speaking from a perspective of supporting care providers to offer the role.
Thank you very much, Helen, and thank you so much for organising this event this evening. As you said, we held a similar event last week with providers, and I think it was very positively received and a positive opportunity to explore this role in detail. And just a bit of background, so the National Care Forum is a membership organisation for not-for-profit care providers, so charities and not-for-profit organisations who are operating care services, care homes, but also a whole wide range of other services such as supported living, home care, extra care housing, and so forth. So a group of organisations who have worked together very consistently throughout this pandemic to promote visiting and the need for visiting. And I'm really delighted that we've been able to work in partnership with Relatives and Residents Association and also John's campaign and Rights for Residents, alongside a whole range of other sector organisations putting together coalitions to highlight the need for visiting. It put pressure on the government to extend visiting and latterly, as Helen says, to pick up particularly on the essential caregivers role. So what we've been doing at the National Care Forum is trying to bring together resources and support for those organisations who are working hard to implement visiting. So we put together some resources with our partners called Partners in Care, which is tied into the new guidance. Those resources are not just for provider organisations, they're absolutely for relatives and residents of organisations, and they lay out a pledge to kind of connect and work together with, and they lay out a set of rights and responsibilities, what people can expect from providers, from relatives and from residents within organisations, what they should be able to expect and what their responsibilities are, and also some resources that go with that. So something, if you haven't had a chance to see, would be really great to have a look at and feed in. We did some survey work with our members just after the guidance was launched on the 8th of March, and we looked at how visiting had gone since the new guidance came in. There was very good uptake in relation to the regular visitor role, and hopefully those of you who've been seeking to obtain visiting through that role have found that more straightforward and more easy following that new guidance. But in relation to the essential caregiver role, there wasn't as much take up at all, and it was clear that there was some confusion around the role. So this is why we think this is really important. We're trying to clarify that role very much for providers. We've been working with Helen on those FAQs that she's produced, which are fantastic because they answer a lot of the questions that I think both providers and relatives will be having about the role. And I think they provide a platform for everybody to fully understand just how important the role is. We've been advocating for it because we know from talking with members just how devastating the impact has been of isolation for residents within care homes from their loved ones, and indeed for those relatives and loved ones themselves. We're very aware of that. We want it to change. We're doing everything we possibly can to make that happen. Helen asked, what do care providers need to hear from you as relatives in order to facilitate the essential caregiver role? And I think it's probably not so much what they need to hear from you, but that, you know, all of this is only ever going to work if it's about a partnership and if it's about transparency of communication from both sides, and if it's about you know, enabling people to have some of the, you know, the quite difficult conversations that need to happen in order to make this possible. We think that there's lots of organisations out there who, given more support, given more understanding of the role now, which we hope that the work that we're all doing together will facilitate, will be able to move into having more essential caregivers as part of their regular cohort of visitors. The key things that we're excited about this role is the fact that it even in the context of an outbreak, should continue. So for your loved ones that you've been so desperate to connect with, hopefully it will prevent that stop-start of visiting that's been happening throughout this whole pandemic. So new guidance, visiting happens, guidance change, visiting stops. What ought to be the case is with this essential caregiver role, that should no longer happen. You shouldn't have that stop-start. It shouldn't be providers stopping that happening. It shouldn't be local systems stopping that happening. But what we need to do together is to really provide as much information about the role, as much information about the changes that the role can bring, and give, make sure that essential caregivers becomes a part of everybody's experience who needs that. Thanks, Em.
That's great. Thank you, Vic. Just a reminder to everybody to use the chat function if you've got any questions specifically for Vic or any of our other speakers, and I'll keep an eye on those and come to them at the end. I was going to go next to Janet, but I don't know whether you're still having problems with your audio, Janet. Are you still there?
Yes, I'm still here, Helen.
Great. Over to you. Thank you.
Back again. Okay. Well, basically, I work for an organisation called Broadening Choices for Older People, which is a registered charity that supports the elderly people of Birmingham. We have 3 care homes, and like most providers, we have kind of been bounced around from one piece of legislative guidance to another piece of guidance to the fracas between what the guidance says and what local authorities are saying, and what public health and local health protection teams are saying, and what commissioners are saying. And certainly over the past year, there have been a number of occasions where they haven't all been saying the same thing. So I think one of the reasons why the essential caregiver visits have sort of hit barriers is because, to be perfectly blunt, the left hand hasn't really known what the right hand's doing. So I think there is a definite need to really focus on the communications of it. We identified back in June that not seeing families was actually causing not just distress to our residents, but it was having a very clear detrimental effect on their physical well-being. We had one lady who lost 10 kilograms. And because she lost so much weight, she gave up, she turned her face to the wall, she put herself to bed, she wouldn't mobilize, her skin integrity was at risk, trying to get her to eat was really, really difficult, because she genuinely believed that she had just been forgotten. And I'm pleased to say back in June, we started trying to fight to get the doors open to have at least one essential caregiver that the resident knew and was familiar with and had a bond with, to be able to come into the home. They are treated exactly like our staff. They are an additional member of the team. And I think providers need to really sort of understand that, because they are actually providing a very valuable service that enables more care and more focus to be given on other people, because nobody loves your mum like your daughter or your son or your family. And they're actually, this lady that lost her weight, since we've had her family coming back in as essential caregivers, she's put all that weight back on. She has begun to mobilise again. She has lost muscle strength and body mass as a result of turning her face to the wall. But the first thing she said when her daughter came back in was, "Please don't ever leave me like that again. What have I done to you? What did I do?" And I think that kind of says it all, in that the very people that fought for the system that everyone's trying to protect were the very people that we didn't protect. We forgot about their mental health. We forgot about that family bond that is so essential to life. And even Maslow recognises family life as being an essential act of living. So in June, we started lobbying our local public health director, our local health protection teams, CCGs, CQC, anybody who would listen, and we got nowhere. But the guidance said, if you're clear for 28 days, you can start having visitors. The staff were extremely nervous. The managers were extremely nervous, because they didn't just want to keep themselves and their families safe, but the residents are their family as well. And, you know, we don't know where families have been. There was no means of testing at that time. When public health came in, they would test 3 residents. That was your maximum, because testing wasn't readily available. But we opened up and we started doing a 2-weekly review. So the first week we would open up to 1 person for 1 visit for 1 hour in the first week. And if that worked, we monitored it the second week. And if there were no further outbreaks, then we opened that up to 1 person, 2 visits per week for 2 hours. And in one of our homes, we've been clear from COVID since June. But then the second wave hit us and we were directed in no uncertain terms to lock our doors and stop visiting again. And it was only essential end-of-life visits. And that caused quite a lot of trauma to everybody, not least families and residents, but to the team as well. Because one of the magical things about working in this sector, and I've worked in this sector for 50 years now, is, you know, we are privileged to be extended family members. We're not replacement family members. And for the past 12 months, that's what we've had to be. So when the guidance started relaxing a little bit, we implemented our essential caregiver, and we did a very specific clinical key indicator assessment on each resident that focused on physical clinical indices such as diet and nutrition, such as people's skin integrity, such as whether they were losing weight, whether they were experiencing more distressed behaviour, whether their depressive state was advancing, whether their dependency was advancing. And if people were scoring more than 3 elements on that physical assessment, then we were saying they needed to have an essential caregiver visit. The public health director still wouldn't let us do it. And so even though it's now been opened from the 8th of March, we've actually been doing it since December. And we've had no further outbreaks in the home that we've been doing it in. We couldn't start in 2 of our 3 homes in December because both of those homes had quite a nasty outbreak. But by including the essential caregiver as part of the team, so they do the same testing as our staff, they do the same training as our staff, they wear the same PPE as our staff, they are, all but not wearing a uniform, members of our team. And they are providing an essential service. And I have to say that our residents have so visibly benefited from that. And so has the morale of the team, because it gives us light at the end of the tunnel that something is getting back to normal. That's it.
Thank you so much, Janet. Really appreciate those thoughts from the provider perspective of a provider that's doing it and making it work and improving. It's really interesting to hear you say, you know, think about staff morale there as well, improving staff morale as well as the impact on residents, which is obviously the key thing. We've got some questions coming in on the chat box, which is great. I'll just hold them until the end, until we've heard from all of our speakers, if that's okay. So Jenny, we'll come to you next to speak from the perspective of a relative who has the role and what that's meant for you and your mum.
Yeah, thanks Helen for organising this webinar, because I really do think it's overdue, to be honest, and it's brilliant that, you know, we can start to explain the role to others. Certainly for my mum, she went very, very rapidly downhill after the first lockdown, to be honest. Even within the first 3 months, she had stopped speaking, she'd stopped eating on her own. She used to be able to stand, she couldn't do that. And as Janet's already pointed out with many residents, my own mum, she was just constantly anxious, sad. She would cry, she'd be fearful if the carers came even just to touch her. These sorts of behaviours, to be honest, we just never witnessed this before in mum, because before the lockdown, she was really quite happy at the care home. She was settled. I would say she had a really good quality of life. And this was really, really heartbreaking to witness. So we got into a situation where mum moved care homes, unfortunately, and we fought to get visits under exceptional circumstances at the time, which we did achieve. So mum moved to the new care home. But to be honest, her situation deteriorated even further, and the anxiety levels, you know, just increased all the time, and the lack of hydration, because she would refuse to drink, she would refuse to eat, and she just would refuse to speak. And it was becoming absolutely critical that we, you know, increased the contact with mum. So we had our contact increased then from, I think it was 2 visits a week to 3 visits. And we maintained that contact throughout until the government guidance was changed. And then obviously the role of the essential caregiver came into force. And of course, we swiftly applied for that role. Since myself and my partner Diane have been entering the home and visiting mum as essential caregivers, the change in mum has just been, well, it's beyond belief, to be honest. One of the carers told me that mum used to cry literally every single day before we were allowed to go in and support her as often as we are now. And you know, they tried to help mum, they tried to keep her morale up, they're brilliant with mum, but she missed her family, you know, she missed that vital connection. The carers are really busy, they can't go into mum's room and do the things that we do when we're in there. So for example, now that myself and Diane are essential caregivers, we go in and we don't just help mum with personal care. And I think this is something I really want to stress to people, because I think a lot of relatives think that if they apply to be an essential caregiver, they'll be required to do all sorts of things that they never did before. So our main role really is to reduce mum's anxiety and distress. So while we're in the care home with mum, we're in mum's room, we're not mingling with any other visitors. Sometimes we just, you know, literally hold mum's hand if she's very anxious and we chat to her. But we do other things. For example, we clean her nails, we massage her hands, we paint her nails, we fix her hair, we play music, and it's just amazing to see mum smile again. We play music, she sings along to the music, you know, she remembers so many things now that we're going back in. She tries to speak now, she tries to form sentences, which she just wasn't doing that before. We read poetry and rhymes to her. We reminisce, and, you know, we, like all of us, all the relatives, we tell funny stories or do sort of remember whens. Do you remember when this happened, mum? Do you remember when that happened? Things that the carers just can't do with mum. You know, we are the only people that could stimulate these kind of memories. We are the only people that could take care of these kind of emotional needs for mum. And as a result, mum, she will drink and she will eat with our encouragement, or sometimes we literally have to feed her now as well. And one of the things that the carers have said to us is that they are really, really pleased that we are coming in, because they just couldn't get mum to eat. She just wouldn't do it. And they are really glad that we're coming in to help, because, you know, as Janet says, these people, the carers are not replacement family members, but they really care about mum. And I know they really care about a lot of other residents, and they wanted mum to improve. So they're really pleased also. But the other thing that they've said to us is that they are genuinely pleased that relatives are coming in like we do to help mum, because they literally can't get around all the other relatives, especially at meal times. It is so stressful for them. So some of it's taken some of the pressure off the care staff, who, let's face it, they're just exhausted. So although we do help with some of the practical things, you know, our main benefit to mum, and our care home has accepted this, is more to look after mum's mental health and well-being. You know, and there's no stipulation for us to have to come in every single day, or have to spend all afternoon, or, you know, we can just spend an hour. basically the care home managers just accepted that it's as mum is on that day or on that week, which is hence the term essential. You know, you are an essential caregiver and you're going to give the care that's required on that day. So we feel hugely like a massive weight of guilt's been lifted off us since we were being allowed to go into the care home. It's unbelievable how we feel as well, that we're helping mum, that we're able to provide some care for her. And it's the benefit to mum, I think, is immeasurable. I don't think it can be measured. It's massive, it's huge. And I just hope that when people, we've had a lot of people contacting us over the last couple of weeks saying that they don't want to apply or ask the home if they can be an essential caregiver because they don't feel they'll be able to provide enough support, or they won't be able to commit to enough hours. And I would say to people, please think about all of the things that you used to do before with your loved one, all of the things that might be different to what I've just outlined, but all of the things that you used to do with your own loved one that only you can do as a family member. Only somebody with that vital connection could provide that kind of emotional support. And I would say, approach the care home. It doesn't have to be a confrontational experience. It can just be initially a discussion to outline why you feel your very presence, as Helen mentioned before, and that's an argument that we made, that our very presence is vital, is essential to mum's, mental health and well-being. So yeah, normally we get on our soapbox because, I remember, one of the co-founders of Rights for Residents, but today we really just wanted to talk about that very personal experience that's meant a huge difference to my own mum and could make a massive difference to many, many other people if they could just request that role.
Thanks so much, Jenny. I'm going to move us swiftly on to Helen. If you want to unmute yourself, speak about your experience as a relative of trying to get the role.
Thank you, Helen. Yes, like many others, I've had a year of frustration and worry and disappointment, and our hopes have been raised and then dashed again around visits. So I was thrilled when Mum's Care Home did decide to open their doors with nominated visitors, but we were going to be in a visiting room and only allowed 30 minutes. And it was at this point that I had to make a decision about how I would approach this next phase. Because like everybody else, what I wanted to do was I wanted to run at those doors, grab Mum and make up for all of the time that we'd lost. But I knew that that wasn't going to work and it would set me at odds with the care home from the outset. So what I decided was that my approach would be take what is on offer in order to move on to the next stage. And so what I did is I did have that visit, that hand-holding visit in that visiting room for the 30 minutes. And from that visit, what I realised and what I knew would always have happened was that, it was a different quality of visit for Mum. She was able to hold my hands and squeeze my hands. Mum's living with late stage dementia, so there isn't any conversation, but just the fact that her eyes were closed and she was squeezing my hand and rubbing my hands was huge progress on the booth visits, the Skype calls, the garden visits, which had been meaningless for me Mum. So that what that did for me was that gave me an opportunity to say something very specific to the manager. And from that first visit, I always knew that I was going to be having a conversation about what that visit meant for me and for my mum. And based on that, how could we move forward with the essential caregiver role? What happened was actually that events overtook me and that was the first week. The second week I had a phone call from the manager who was telling me about Mum's needs changing and her moving to a different part of the home. But that helped us with a conversation around how could we now support Mum in a different way, and that led really quickly onto me gaining status as an essential caregiver. So as of last Thursday, I was allowed to go into Mum's room. Initially it was for a time, a specific time, but the manager has been very supportive and said, if your mum's eyes are closed for some of that visit, you just extend the visit. If you want to do some stuff in your mum's room while you're there, you do that. And as of today, because I've had another conversation building on that first couple of essential caregiver visits, she's now said perhaps she'd like to come in and help mum with eating. So I can actually start doing some of those things. And as Jenny says, I don't feel any compulsion to be there. You know, I have to be there 7 days a week for 3 meals a day. I feel that I can now be part of the care team. And just doing that, if I can share very briefly, yesterday I was visiting mum, and I helped her with a drink. And at the moment she's drinking with a spoon and thickened liquids. And just the very process of being able to give my mum something to drink, and her responding, she wasn't speaking, she was responding in a different way, was a huge, huge change for me, and is worth, you know, 10 of the Skype calls. So it's meant so much more. And my view now is that I'm going to keep building on this to stimulate my mum. I have low expectations of my mum's ability to sort of move to where she was when we left her back in February of 2020. But I've got really high hopes that if I keep going and I keep stimulating my mum with the music that she knows, with the hand holding, with the family stories and jokes and names that she'll remember and sayings that she knows, that I can get back to something with my mum before she eventually dies. The only other thing I would like to share is that having had conversations with my care home, my mum's care home manager, the thing that I've learned is what I'm determined to continue to do is have the conversations about what can we do. I don't want to hear about what we can't do. Every conversation is, well, what can we now do? What can we now do? And I think that for family members has to be the way that they regain their status as partners in care, not to pull down the doors or not to overtake, but just to work in a way that's meaningful for the resident and doable for both parties.
Thank you so much, Helen. Sorry, my mouse got stuck and I couldn't get to my mute button. That was really helpful. Thank you so much. We've got quite a lot of questions coming in on the chat, and I can see some of you are already starting to answer some of those questions amongst yourselves, which is really helpful. So there's been one question around support for care homes around the risk assessment. Is there something that we can share or do with care providers? Because there hasn't been very much coming forward in terms of, you know, template risk assessments, for example, to support care homes on how to actually do an individual assessment. Vic, I didn't know whether you wanted to pick that up, because I've seen you've put something in the chat about what you might be able to do as the National Care Forum on that.
Yeah, I mean, we're certainly, you know, Janet's very kindly shared her materials and we've shared those around with people. I mean, I think what most care organisations, care homes would say is that they have got due process to carry out risk assessments and carry out individual assessments of people. So, you know, that bit of it shouldn't be a barrier in that sense. I think the comment that was in there that really, I think definitely we would want to be challenging is the idea that that's carried out without any engagement of people who care about that individual and indeed that individual themselves. And so I think, I mean, you know, I think there's great value in templates and things that kind of give people ideas, but my working assumption would be that people have got tools that they already have, that they carry out individual assessments of people's needs more generally, and they need to think about adopting and changing those to include visits, and they should have been doing this already. And I recognize this is really challenging for me to say that's what should be happening, but that is what should be happening, and that's what we very aware that the regulator, for example, is taking a much more keen focus on that, and that's exactly what they'll be looking for. They'll be looking for care homes to evidence that they have got a systematic approach to doing this. So I can't remember if it was Helen or who put in the chat, but the idea that they can just do this based on a little chat with you is not acceptable. It's about having something. And I think the other thing I would emphasize there is, just because the decision is taken not for somebody to have an essential caregiver, and I think that's, you know, that is part of the reality. This is designed as a role that is highly relevant for some people, but not for everyone. Just because a decision is made that essential caregiver isn't right at that moment, that is not the end of the story. Things change, people change, needs change, and that process it's become also jargonized, hasn't it? But this, you know, has to be part of a dynamic risk assessment that recognizes when things are different, and you should be able to alert the care home that things are different, just as they should also be noting that themselves.
Thank you, Vic. We've also had a couple of questions. Janet, I didn't know whether you wanted to just pick up on a couple around outbreaks, whether there's a barrier for some people around the local public health team saying that they can't continue during outbreaks, and a specific question around whether the essential caregiver role should be allowed when someone's isolating. I mean, I think both are pretty clear, particularly the first one in the guidance, that it can carry on during outbreaks. And I think, you know, if it can carry on during an outbreak, then it should certainly be able to carry on when someone is self-isolating, for example, after coming, you know, if they've moved home or whatever. I wondered how you had sort of dealt with that in your home.
The difficulty we have had is that the guidance may say that it can continue during an outbreak, but then you have your infection control and prevention team and your local health protection teams and your public health teams, and they say, no, it can't. And you say, but look, this is what the guidance says. And so if I can link in with what Vic has said and what's being said on the chat about the process, I think it is part of care planning. If we're saying that this person needs to have an essential carer able to visit them, that is part of their care plan. And that should link into the care plan for where we have identified the need. Like, we have one lady who visits us, and if there's any providers on the call, they might appreciate this. One or two of the relatives might not appreciate it so much, but I'm going to be honest with you. We have some relatives who really have been extremely anxious, and their anxiety has actually impacted on the care home's ability to deliver care to other people in that care home, because these people may have been on the phone 3, 4, 5 times a day, or they may phone twice a day and want to be on the phone for an hour, or they may ask for FaceTime visits and then phone for an hour or so after the FaceTime visit. And what we identified with one particular lady was the anxiety, the need for visiting wasn't the resident's need, it was her need. But by consulting with the resident who has capacity, he wanted his wife to visit, because if she was anxious, he was anxious. And so we actually log this in the care plan. So we have an essential caregivers care plan that says why they need to visit, and recognizing the emotional and psychological effects, because if your family hurt, you hurt, don't you? And you know, our residents are no different. They don't stop loving, they don't stop caring just because they're in a care home. They still have those family feelings. And we managed to get the team on board by actually saying, you know, the one thing that everybody seems to have forgotten here is that empathy. And we have to try and walk in their shoes.
There's a few more questions around some tips for people on, would it be helpful to involve GPs, for example, thinking about the impact on well-being. And And there's also a question around, should there be a time limit on visits? So I think some of these things we will be picking up in the frequently asked questions that we're going to be publishing. So for example, on the time limits, no, there shouldn't be. On the GPs, yes, that's a great idea. And there's other questions around, you know, these quite a lot of care homes will just say, well, it's just guidance, and we're going to, you know, we have to do our own thing. So I wondered whether I'm just going to keep my eye on the questions as they come in. Helen, I didn't know whether you wanted to pick up on any of those in terms of your experience, particularly around the time limit. As someone who, you know, has a mum with advanced dementia, what that would mean for you if you were only restricted to sort of 30 minutes or something.
Yeah, time limits and sort of time slots was a big issue for me from the very start, because I knew that mum could not perform at a specific time of day within a specific time slot. I always talk about warming mum up, and it takes mum about 30 minutes to even, you know, realise that there's somebody else there. So what I've done is, from the very first visits, which were in a visiting room, I've accepted it, but then said, this doesn't quite work. Can we then move to the next phase, which came about with the essential care giver. When we did get the essential caregiver status, originally it was supposed to be for twice a week for 30 minutes, but quickly I was able to renegotiate that with the manager, because she recognised, and what I used was the evidence from the previous visits to say this doesn't work. So if you're able to give robust evidence to say, well, this is what my mum or my dad needs, then it's a very difficult counter argument to come back and say, well, if your mum needs longer than 30 minutes, you can only have 30 minutes. So I've tried to use specific examples, specifically what mum has been able to do, when she's been able to do it, the downtime when she sleeps, that is lost time in terms of contact, and that's the way I've been able to extend that time. I don't know if that helps.
That's great. Thank you so much, Helen. Jenny, yeah, go ahead.
I think personally, in terms of this time limits, I think there is some care providers and some visitors, I think some relatives we're all getting confused with the role of a nominated visitor, where I think people in general are accepting that it's a visit. It could be a family member, it could be any member of a family, really, you know, that's that regular visitor. And so I think in general, time limits of maybe an hour or whatever, people are accepting of that. But my understanding of the role of an essential caregiver is that these should not be strict time limits, because when we're hearing that somebody's got the role as an essential caregiver, but they're only, and we've heard this quite a bit at Rights for Residents. So a care provider says, yes, you can be an essential caregiver, but you can only visit for an hour twice a week. That is not an essential caregiver, that's a nominated visitor. And I think people need to be very clear when they approach the care home that they are not applying for the role of, a nominated visitor with 2 hourly visits a week. If they are essential to that person's mental health and well-being and their emotional needs, that should be identified in the risk assessment. So again, you know, it is individual, and I think we need to stress that with care homes when we approach them, and identify, as Helen said, all the things that we could do, and that these things, you know, they're not really defined by time limits. You know, it does depend on the needs, and it should be flexible. So I think we've got to watch that when we apply to be an essential caregiver, we don't end up accepting the role of a nominated visitor just because we're really grateful to have those visits and we're so desperate to have the visits, because I honestly think that's happening quite a bit. For example, in our family, myself and Diane are essential caregivers, and our visits are very flexible and they're not time limited, whereas my sister is the nominated visitor additionally. And she goes in twice a week for an hour, and she accepts that because she doesn't want to commit to being an essential caregiver. So we have very, very different roles, even though we're all visiting mum. So I hope that helps people anyway.
That's great, thank you. We've only got about sort of 10 minutes left. I was going to run through some sort of tips which will actually pick up quite a lot of the other questions we've got in that have been coming through on the chat box, and hopefully we'll kind of summarize quite a lot of the points that have already been made. So what we're hearing from families on our helpline is very similar to some of the things that are coming through in the chat box there. We're hearing a lot of fear to even ask about getting the essential caregiver role. People don't want to rock the boat. They might have only just been given access and had their first meaningful visit in a year, and they don't want to put that in jeopardy. They think that some care homes will say no. And that, you know, the resident is eating fine. She doesn't need you to support her to eat, for example. And we're also hearing that support is being broadened and contact is being broadened, but it's not necessarily being called the essential caregiver role. So that if there was an outbreak, for example, then that role could be stopped. And we're also hearing, sadly, still some blanket approaches around people who still aren't getting individual assessments, so the home can't know if they need that, the person needs that support or not. And I think communication here is key. Speaking to the care home, opening up those lines of communication about the role, and you will know your care home best. You will know how you communicated with them previously and how that has gone well and where it might not have gone well, and how to approach that. And your relationship with them, I mean, we're talking about over a year now of visiting restrictions. So your relationship with, you know, your loved one has been hampered throughout this year, but also your relationship with the care home. And you might need to do some work to sort of rebuild that relationship with the care home and how best to do that. Whether it's best to go down the road of sort of encouraging the care home, thinking about approaching it from, you know, what you can do to support them and how it will help them with the essential caregiver role, or whether you've already tried that and you need to go down the road of actually this is now in the guidance and it's also about your legal duties, and think about whether that might help. And again, it's not about raising that in a confrontational way, it's about raising it in a way that will open lines of communication and help them to understand the role more. So helping them to overcome the fears. I think this is something that came out from Janet, and I'm really sorry we've lost her, but in the chat we were having before about what will work best with care homes, remember that they are coming from a place of fear as well, and thinking about the virus is still out there, we still have to manage it, we still have to live with it, and what will help them to overcome their fears. So they might have a fear of being overrun if they open up this role, and talking to them about that, talking to them about how unlikely that will be. And it's actually based on individual assessments and who needs it. And thinking about how many people were there on a daily basis previously, before lockdown, before COVID happened, and how many people might need to be in there now. Reassuring them that you will be as safe as the staff. You'll have the same testing, same PPE, follow all the same safety measures. In fact, you may even be less of a risk than the staff because you will only be seeing that one resident. For some people, talking about a phased approach might be the only way to get this happening. And, you know, we don't want to just be accepting something, just saying yes to anything because, you know, we're scrambling around just to try and get any contact, but a foot in the door and saying yes and doing a trial run and letting the staff see that you're not a risk and that you are going to follow the rules, and that how much it will help, and letting them see the impact of that. Reminding them that this is now in government guidance. And attached to legal duties as well. There's a right to well-being in the Human Rights Act, which all care homes need to be thinking about. So this is not an added extra. This is about a fundamental way that care homes will be able to protect people's well-being. focusing on the impact on the person, focusing on the resident, thinking about their emotional needs, their mental health support, the practical support you might be able to provide, and the memories and connection that you can provide, connecting them back to the life that they had before. They've been, without that for a year, and that will have had a huge impact on them. And these are things that staff just can't do. They don't have the time to do it, but also they don't know those memories. You know that person best, and you can only play that role. If you're hitting barriers around the individualized approaches, reminding them that that is now required by the guidance, and the guidance states that several times, that individual assessments are the route to all of this, and they're required by other laws. So the Equality Act and the Human Rights Act both require those individual assessments. And it's only through knowing through those individual assessments that they'll know whether the essential caregiver role is what the person needs, whether it's necessary for their well-being, remembering that things will change and they need to be kept under review, and that things will have changed over the past year. So even if you didn't provide that role before COVID, you might need to now. There's been lots of confusion about the role, so you might need to do some work to help the care staff to understand the role. And we've got a summary document on the Relatives and Residents Association website about what that role is, and we've also got the FAQs that will be published shortly. It's not just about where it's critical for someone's health, it's about the wider well-being, as we've said. And thinking about how it will help the care home, being clear about what kind of support you are willing to provide, and how that will help take the pressure off the staff, that you'll just be able to be there and spend more time with the person. And I think Janet said this really well, that no one can replace your role. The love and support that you provide as a relative or a friend of that person in care is completely different to the staff's role and what they provide. So you might need to do some work to dispel some of the myths that have created around the role. You can bring in others to help you to do that. A social worker, for example, can help with those individual assessments. And we've heard that local health protection teams might be a bit of a barrier as well. So bringing them into the discussion and writing to them directly even about what impact you think your presence or your support will have for that person to help get things moving. And being clear that it's actually okay for homes to have different rules for different people. Again, the guidance is now really clear on this. It's actually a requirement, again, of law, of the Equality Act and the Human Rights Act, to see people as individuals and to treat them as individuals. And so that doesn't mean we have the same rule for everybody, and that if we allow the essential caregiver role, that everybody automatically gets an essential caregiver. It's actually, and some care homes are worried about that because they're worried that that will seem unfair. But actually the fairness there comes from the process that they use, and having the individual assessments and making sure they treat everybody in the same way in giving them an individual assessment, thinking about them as an individual and what they need for their well-being. And again, we've said it's all about protecting well-being and about making life worth living again. And our helpline has heard, as you know, you've all said in the chat function, and as people have said in their remarks, about the impact that isolation has had over the past year on not just mental health but also physical health. That's why we started our campaign to end isolation in care, and that's why we pushed for this essential caregiver role to be put in the guidance. And now it's really important that we all work together to try and make that happen, and so that every resident who needs one can get access to one. So thank you so much for joining today. I hope that's been helpful. And as I say, we're going to be sharing this much more widely to a wider group of families, relatives and friends of those in care, to help other people to push for this role as well. So thank you so much to our speakers, and thank you so much for joining us today. I'm sure we could have talked about this for about 3 hours, if not longer, but you know, we all get tired with our screen time. So I'll just say thank you so much, and please do get in touch with us. Our helpline is here to help you if you need some support, and we'll be in touch shortly with those frequently asked questions we've been promising, which will hopefully answer a lot more of the questions that we couldn't get to as well today. So thank you so much.